Welcome to Breast Intentions, the podcast where we take off the bra of expectations and dive into honest, empowering conversations. We're your hosts, Nadine and Cynthia, two Canadian girls who swapped snow boots for flip-flops in the Cayman Islands. This is your space to feel seen, supported, and a little less alone. So grab a cup of coffee or a glass of champagne and get ready for your weekly handful of truth, wellness, and empowerment. Welcome back to Breast Intentions. Today we're talking about the backbone of wellness, literally. Dr. Derek Spence, chiropractor and owner of Modus in Grand Cayman, has spent over a decade helping people move better and live pain-free. Known for his direct approach and sharp diagnostic skills, he's here to share how small shifts in movement can lead to big transformations. Let's dive in. Hi, and welcome back to Breast Intentions. Today we have our first male guest on the podcast with us. It is Dr. Derek Spence. Hi, Derek. He is a chiropractor in Grand Cayman at Modus. He's going to tell us a little bit about that. Tell us about your journey to becoming a chiropractor and what inspired you to open Modus in Grand Cayman.
Well, I think becoming a chiropractor is probably the same as most chiropractor stories. They probably played sports when they were younger, grew up in the sports world, and were interested in like the human body, right? Kind of have two ways of becoming a chiropractor. You either grew up with a chiropractic family or you were treated by chiropractors when you were a little bit younger. So I was graduating university with an exercise science degree, and randomly the guy sitting next to me in class said that he was going to chiropractic school, and I was like, hey, that sounds interesting. So I applied, got in, and figured I'd give it a shot. Chiropractic school was another 4 years after undergrad, so I know it was going to be a long haul, but I wasn't ready for like the real world yet. So I said, how can I delay this as long as possible? Got to school, met a bunch of good guys up there, and really kind of fell in love with what we were doing. There's obviously been some ups and downs. I practiced for 4 years, 4.5 years up in like the GTA in Toronto in Canada. Got kind of sick of the weather and the slog of stuff up there. There's a lot of chiropractors on every street corner kind of thing. So really trying to find your way through all that, it was difficult. And then you add in the winter weather and all that kind of stuff, and it was kind of like one of these like I need to change, right? So just went kind of looking around to see where there was opportunity kind of around the world, and a job posting in Cayman came up, and I kind of jumped at it when they gave me the call, said I could have it. I worked at that clinic for 5.5 years when I came down here. And then just about 3.5 years ago now, I opened up Modus, which is the clinic that I own, and we have 2 other chiropractors that work with us now. So we've grown quite a bit in the past 2 years, but we're a little bit smaller than some of these other clinics in Cayman, and we're just really focused on chiropractic. So we're not doing everything else. Just 3 chiropractors doing our thing. So
one is Isaac, right?
One is Isaac, yeah. Okay. Dr. Norman, yeah. Okay. So he's been down here about 2.5 years as well. So he came on pretty early with me because I needed help pretty badly. Yeah. And he's been a pretty good fit. He's a good dude. So
and your third?
Dr. Wyatt. And so she's been down here just over a year, maybe even close to a year and a half now. Mm-hmm. Time's been actually flying. But it's great because we have a really small team and we all get along awesome, which kind of keeps the vibes in the clinic pretty good.
That's great.
And I think that kind of translates into kind of like our care for patients and the way we get along with everybody and the way people kind of resonate with the clinic a little bit too. So
Right. Do you have a personal philosophy on health, wellness, empowerment? And if you do, how does that shape how you provide care at Modus?
I think when it comes to the philosophy stuff, Modus is Latin for movement. So that's my biggest focus when it comes to kind of like the world of care that we provide in healthcare. Obviously, we're not prescribing medicine and doing all that kind of stuff, but our goal is to get people moving and keep them moving as much as we can. So that's the philosophy of that. And kind of the biggest reason why I started up Modus was that I really noticed that the cost of healthcare, especially in Cayman, has been skyrocketing. And it seems like every year the copays are higher, people's insurance rates go higher, all that kind of stuff. And I didn't really like the feeling of that because I feel like healthcare should be something that should be attainable for everybody. So our goal was always to kind of keep a really kind of even entry point for everybody to come in and get proper healthcare, chiropractic care. I know we can't do everything there. But yeah, the biggest thing for me was I saw that Cayman was kind of moving in a direction which is getting more and more expensive everywhere, but I don't think healthcare should be included in that as well. So our whole thing is kind of affordable, easy access to healthcare and stay moving. So
Nice.
Yeah, very good. I personally, I come to see Derek. Derek's my chiropractor. I've been noticing more hip pain, more neck pain. I always kind of had the neck pain. That's been kind of ongoing, but it's gotten a lot better after starting treatment with Derek for sure. But this hip pain in the hip joint and the back, lower back, that's kind of a newer thing for me. Are these normal parts of aging, or is there maybe more to it? Is there, I guess the question would be, what's happening? Is there something happening to my body during perimenopause, during midlife that could be affecting this?
yeah, so I think people always get scared to actually say that, yeah, when you get older, stuff hurts more, right? And
You want to admit it? You don't want to admit
that's
it?
just part of living, right? Too.
Mm-hmm.
Being uncomfortable, being in pain, all that kind of stuff. It's not something we want to be, but like as we get older, everything does start to degenerate a little bit. So if we look at kind of spinal joints and all that kind of stuff, as we get older, we get a decrease in disc space, all that kind of stuff. And it's normal. If we x-ray, MRI a lot of people, we see a lot of that same stuff in their spine. As we get older, things shrink, get smaller, put a little bit more pressure on things that we don't want them to. So yeah, it is part of aging, but it doesn't necessarily have to be. You know what I mean?
So how can chiropractic help with that?
Our goal is always to provide you treatment like loosening of soft tissues, mobilizing spinal joints. But the end all be all is always to get you moving more, right? The more you can move, the better off you're going to be. So we want to remove the limitations that are stopping you from being able to go out there and be more active and move more. Like it's not a miracle thing, the things we do in the clinic or anything like that. It's simply helping you to feel a little bit better so you can go out and make yourself better.
Right. So like we've heard, oh, that's just a part of aging, or, you know, you're getting older. Of course your joints hurt. Like, are we normalizing something that we can do something about?
I think we're normalizing it, and that's not necessarily a bad thing. Like we have to understand that like pain and discomfort is part of just life, right?
Okay.
When we were younger in our 20s, there's a lot of times you'd wake up in the morning and not feel a thing, right? And I think the big thing is now differentiating between what's kind of like uncomfortable and normal discomfort and what's kind of pain, right?
Mm-hmm.
And there's a difference between those two things, right? There's some things that are painful and scary and you can't move and all that kind of stuff. We don't want to be dealing with that stuff. But normal aches and pains after sitting down in your office too long, maybe even after a hard workout, those things are normal. So I think we do have to normalize, but also kind of learn ourselves and our body what is good pain, what is bad pain. And that's very difficult for people to do because they associate everything as this is bad. This is bad, right? Because nobody wants to be in pain, but pain tends to be like a warning signal to you, like, hey, we need to change something that we're doing. And if we don't change that, it's going to keep on happening, right? So where we step in is to kind of be that stopgap to hopefully stop that from happening and kind of give you their education to, hey, this is good stuff, this is bad stuff. And that's how we're going to kind of move forward with that.
Yeah. Well, for some people, I can see it going the other way too, where I'm just like, well, it's just a part of aging, and I maybe let it go too far.
Yeah, and we see that all the time too, right? The longer you leave something, the worse it tends to get, right? But if you're not changing the habits, even outside the clinic, outside of your normal routine, then stuff's always going to stay the same and probably get worse. If you're sitting down and you don't change, you don't start moving, and you don't start exercising, stuff's going to get worse and worse. And sometimes you leave it too long, and that's when people come in and are in a ton of pain in the clinic, and we see that all the time, right? We'd rather catch stuff early, right?
Mm-hmm.
If stuff's feeling stiff and tight and uncomfortable, sure, come in and get it checked out. Because it is normal to feel that, but we don't want that going further, right? Like we don't want to sit back, oh, I'm just getting older, I'm going to be in pain every day. Because yeah, we're going to feel stuff every day, but we don't want to be in pain every day.
Yeah, that's the difference right there.
Big time.
Yeah. What could, women in midlife specifically, but perhaps anybody, do proactively to protect their spinal health or their overall mobility as they age?
I think it's just, it is just about movement. The biggest thing that any women, especially as they get older, is bone density, right?
Yeah.
Mm-hmm.
And that starts early on. And a lot of times you can't recover that stuff, but you can slow down the deterioration of that, right?
Mm-hmm.
We kind of hit peak bone density as men and women around like 25, 30 years old. And it starts going downhill after that. Yeah. And the guy's curve goes down a little bit more gradually. Women go a little bit steeper. And once you hit menopause as a woman, it kind of falls off a cliff a little bit, right?
Okay, yeah.
So as you're heading towards menopause and all that kind of stuff, you definitely want to be focusing on kind of resistance training and stuff that's going to help that bone mineral density kind of stay as high as possible. When it comes to the actual treatment with chiropractors, it's not going to change a lot. A lot of stuff I do with women, middle-aged men, young women, doesn't change a ton. We're still doing and trying to achieve the same things. And again, the biggest thing for you guys always to think about is like, what are we doing outside to kind of keep our bodies in the way that we want them to be, right? So, and again, it's all about
strength training,
right? And I think that's the big missing piece for a lot of people, right?
Yeah.
And it's awesome to see now that women are getting more and more and more into strength training. Even in the last like 5 years, it's crazy.
Yeah.
Where before you almost had to force women to go lift weights and force women to do this because they'd go hop on a treadmill and that's about it, right?
Yeah. Well, there's a stigma around it. Or, there still is.
There still is a little
but probably more so before, where I'm going to get bulky. I'm going to look like a man. I'm like, if you only knew.
I want to be bulky and I can't do it. I can't do it.
As much as you lift, you can't do it.
So it's kind of like one of those things where it's cool to see there's been a big shift in that. And there's definitely a lot more women doing strength training and resistance training, all that kind of stuff as well. With that being said, we need to hit it from all aspects, right? You can't forget about the cardiovascular system as well. And even things as simple as walks when you're done at the end of the day at work are huge that people don't seem to do enough of. Yeah. Right. So.
Yeah, we're sitting in an office 8 hours a day, go home, sit on the couch, watch Netflix.
Exactly.
Yeah.
And not moving enough, right? And I think when it comes to our overall health, especially from the chiropractic perspective, it's kind of the more movement you can get, the better.
Well, what if I'm sore?
Go walk. Go swim.
Okay.
There's an ocean right across the street here. Let's go hop in that
and
thing.
most of us have pools.
Yeah.
Yeah.
If you get in the ocean, you get in the pool, gravity's weighing on you a lot less. Things are going to feel a lot better.
Right.
That's a good tip. Yeah.
There's not any reason not to move. Okay. I think people get scared of moving when they're in a little bit of pain, but the worst thing you can do is sit around and do nothing. That old thought that I'm sure there's still some doctors out there that say it, that like, oh, if it's sore, just rest it.
Yeah.
That's a lot of BS because it's kind of like you need to move those tissues or things just never go back to the same, right? So you got to learn to work within your limits of kind of, okay, if I'm pushing myself to a 9 or a 10 or a 10 pain when I'm moving, don't do that. Right?
Yeah.
But some discomfort while we're moving is okay, right? And we also have to teach our bodies that the movement isn't scary and dangerous and all that kind of stuff. And that's where something like the pool, the ocean, all that kind of stuff is amazing.
Right.
Yeah.
Let me ask you a question. Where do you tend to see people, let's just say women, where do you tend to see the most aches and pains? Or like when a woman comes to see you, where is it usually where she's struggling the most? Is it like the neck, the back, the hips?
Well, again, a lot of the time it's one of these things where, like I said, it's not much different from men to women what we see a lot of. Just because our lives are pretty much the same, no matter what we're doing. But most people come see us first for neck, low back stuff, because that's what chiropractors are known for. And then once they get to know us, they go, oh shit, my hip's hurting, my knee's hurting, all that kind of stuff, right? So we treat everything, but kind of our bread and butter that people see us for first is neck and back stuff. And I do think as women get a little bit older and all that kind of stuff as well, the low back and the hips tend to start being more of an issue as well. And I think that might be, again, a lack of kind of movement stuff. But it's the same thing, sitting at a desk all day long, hunched over your computer. Yeah, your neck's going to hurt, your shoulders are going to hurt, and all that kind of stuff too, right? So again, it probably doesn't change a ton with gender as far as kind of like what the aches and pains are. But yeah, like most people call us first, hey, my neck hurts, my back hurts, I can't move, this kind of stuff. And then once they find out that we're good at what we do, we can kind of treat a little bit of everything, right?
So then do you encourage people to come and see you without the aches and pains, like just as maintenance?
And so that all depends on the patient, right? A lot of times, I think there's a little bit of a negative stigma when it comes to chiropractors that once you see us, you're going to see us forever. We're going to set you up a long treatment plan. I did hear that.
Somebody did tell me that, I would say a decade ago when I was first thinking of going.
Yeah.
It's just old school thought.
And I think the old school chiropractors, it would be like that, where they try to sign you up for a long package of treatment. And yeah, it's not really beneficial to every patient for that type of stuff. We see patients, we get them better, they leave. There's some patients that we see that they come back and see us once a month, once every 2 months, just for a little bit of like what they like to call like a tune-up. And all that happens there is we're trying to just catch some stuff getting tight before it turns into something a little bit worse.
So that doesn't turn into that. Yeah, exactly. I would say that would be my experience. Like I would, in the beginning, I came weekly.
Yeah.
And then I was feeling better. So we moved to every 2 weeks and then we moved to once a month. And then I think
she ditches me now and doesn't come see me at all. So but that's what we want.
Then I just invite you on the podcast.
Yeah, we want people taking some of that their healthcare into their own hands a little bit too, right?
Yeah.
I'm not going to be pushy and say, hey, I need to see you once a month. I see one of my chiropractors.
You might recommend it if that's what you think is the best.
And it all depends what you're doing too. If you're going to the gym every day, working out, like I see one of my chiropractors probably every 2 weeks. Like but I'm sore a lot of the time. And I'm like, hey, like I feel better when I have treatment, right?
Yeah.
I feel like I can work out harder. I can do stuff a little bit better when I'm getting treatment on a regular basis. So it's like some people want to wait and want to see, I'm going to wait till I feel something. I'd rather just feel good all the time, right?
No, and I do. Like if I come, well, I was coming regularly, then we kind of backed off a bit. But then I was noticing some more of these hip and back problems. But if I go, well, no, I'll just stick to the once a month, then I'm never really feeling good.
Yeah.
But like it's that more consistency, that more regularity just to get to that place.
Exactly.
And then maybe once a month.
And then back off a little bit again, right? And again, we've had the conversation a lot where it's kind of the more we can get you doing outside of the clinic, the less you're going to have to see me as well, right? So the more stuff that we can get you doing actively, the probably less you got to see me. The people who, we have people who don't want to do anything. They don't want to do any exercise. They don't want to do any of that stuff. And you try and drill it in their head, like, hey, like, just do this. You're going to be better off for it. But they'd rather come and see us. And like, we're going to help them through some of that stuff. But I'm going to be in their ear every single time they're in there. Like, hey, just go for a walk after dinner, right? Like, just start somewhere easy, right? So
that's probably the toughest
for sure.
disconnect with people. Right? I get it.
How can prioritizing physical wellness through chiropractic care contribute to a sense of empowerment and self-confidence?
I think it just goes back to the same stuff we were talking about with fitness, gym, and all that kind of stuff too, right? Our goal is to get you to a better place. Like I think any chiropractor is going to tell you that their goal is to get you to a better place where you can live your life better, right? And I think if you can be more comfortable, less pain, move more, be stronger, get
it's a domino effect.
Exactly. It's just like we're a piece of the puzzle. I'm not going to sit here and say chiropractic care is going to change everything, but we're going to be a piece of that larger puzzle that we're kind of looking for. And that's very empowering, knowing what your body is actually capable of too, right? And a lot of people that haven't seen a chiropractor or haven't really taken care of their body in any way, whether that's seeing a physiotherapist, massage therapist, anything like that, haven't had much body care, they don't know what their body is actually capable of, right? So once we're able to kind of get through that and kind of explain everything, human body is pretty amazing, and we just got to give it the right push and let you guys know what's happening with it, right? So,
well, and I think there's so many people that, like you were saying, aren't body aware, and a lot of that comes from social media or the industry where we are taught by them that this is how we should feel, but we have never actually taken the time to sit within ourselves and say, oh, okay, well, this is actually how I feel. Not listening to anyone else, but this is more just how I feel, and being able to communicate that to people like you, and being able to be open enough to being treated. And then you just see like that domino effect happen for people.
Right. And like I said, like, I think anybody who goes years and years and years and it's some sort of discomfort or pain and everything like that, they kind of don't know what normal feels like anymore, right? So you forget what that feels like until it's given back to you. And then you go, wow, that's pretty crazy, right? So it's like you said, social media, good and bad on both sides of things, right? Like there's some great education out there, but there's also some things that scare people a little bit too, right? But I think like the way you feel within your body and your body awareness is so individualized, right? Where like nobody else can tell you what you're feeling, right? So people come in and tell us all the time, like, hey, I've been to a lot of other practitioners, they don't listen because what I'm saying doesn't make sense to them. I'm just like, yeah, but whether it makes sense physically or not, you're feeling that, right? Yeah. And there's still a way around that because there is a big mental component to the pain stuff as well, right? Where just because we don't have the same physical findings we'd have on another patient doesn't mean the patient's not experiencing pain, right? Yep. And that's where stuff gets really funky and tricky, right? When we got to start kind of playing with the brain a little bit there too. But again, what's the default to that? It's about moving and showing them movement is kind of pain-free. And if it's not about hands-on care with them, it's about taking them into like the rehab, the gym area that we have at the clinic and showing them some safe movements to do and reteaching their body how, hey, movement's not scary, movement's not bad. Because sometimes you got to rewire that brain a little bit too.
Especially if they have in the past felt pain or discomfort and they're kind of remembering that, or they're afraid to get back to that.
And it, like there's this weird cycle of pain where it's kind of like sometimes the body can't break it, right? Until they're kind of given the right advice, the right movements, the right anything, where you get stuck in this kind of thing where like, the body heals itself, right? So most injuries, probably 6 to 8 weeks, you should start noticing a change even by not doing anything. If somebody's having the same pain for a year, there's some other aspects going on as well that aren't only physical, right? And that's where we have to also treat that as well as a little bit of a harder case to deal with, where you can't just come in and just get some soft tissues, you get some adjustments and then feel better. Like we need to re-educate a little bit as well. So.
I was just going to say, so is there a huge component of what you do where you actually just sit with your client and talk to them?
Yeah, for sure.
Get to know what happened and what their past is like.
So again, I think old school chiropractic would be very quick appointments. You'd be in and out 5 minutes kind of thing, right? So our initial appointments, 40 to 45 minutes where we sit down and talk. We try to fit some treatment in if the case isn't too complicated. But every time everybody's in, like we allot half an hour with everybody. And there's some patients that we need to add a little bit more because we know who's coming in. But that gives us a chance to kind of like catch up and see where everything's at. So it's not just this, get on the table, let's adjust you and move on, right? Like we have to be able to kind of chat and connect with the patient if we're going to figure out what's actually happening with them.
That's what people want.
Yeah.
People want to be able to connect and people want to be listened to
for sure
and heard.
Yeah. Definitely. Are there small daily habits women can incorporate at home to feel more in control of their health and physical well-being?
At home?
Yep.
Go for a walk. Go for a swim. Easy. Like it's
stretches?
Again, stretches are all going to be dependent on each person individually, like what's feeling tight, what's not, right? So it's very hard to kind of come up with like a short list of like, I know you go on the internet, like, what are the best stretches? And there's a stretch out there called the world's best stretch. I'm like, yeah, sure, it's great, whatever, right? Like, okay. But again, it's an individualized thing. It's like, you don't want to overburden somebody like, hey, do this stretch because this one's going to fix everything. Because it's not. Like anytime anybody says this is the thing, it's never the thing, right? So, and
honestly, like when say my physiotherapist gives me stretches to do.
You don't do them.
I mean, how many times do I do that?
No.
Right? This where like I like to tell patients, I'm like, homework is great. And there's a lot of stuff you should be doing, right? But there's so much benefit that just comes from going for a walk with the way that the gait pattern works, kind of swinging, rotation, extension, flexion, all that kind of stuff through the spine, through everything in your body. There's not many things out there that are going to dynamically kind of just and easily move stuff like that. It's low impact. So it's like, if I tell my patients, if there's one thing you can do for me, if there's one thing, just go for a 15, 20-minute walk every day.
How fast are we walking?
As fast or slow as you want.
Okay.
Yeah, just move.
Just move.
Right,
just move. I know this is going to get very repetitive on this podcast. Right? Just go move. So
we'll cut it down to 5 minutes.
Yeah.
The question that I ask you at the end.
Yeah. Just move.
It's one piece of advice. For those of us who sit at desks and spend hours at our computer and scroll on our phones, what's one easy adjustment that we can make today, like in our daily lives with our posture?
I think the big thing is that a lot of people think of posture as being this kind of like static, like squeeze my shoulders back and down my back kind of thing, right? Posture should be a very dynamic thing, right? So if we take a snapshot of anything, if you're sitting like this, I'm sitting like this. If I sit like this and my posture feels like it's good right now, if I sit like this for 8 hours a day, every day, it's shitty posture now, right? It's kind of like, it's supposed to be more movement. So this is where now that people are getting more stand-up desks and all that kind of stuff, it's like varying your position. So even if you don't have a stand-up desk, change the way you're sitting, change the way stuff's set up a little bit throughout the day, right? When I'm trying to just check on where my posture is too, I don't do this whole big squeeze my shoulder blades together because now we're throwing everything else off a little bit.
Right.
I think the biggest thing to think about is trying to really open up through the chest. So I like to do this thing where I just kind of rotate my shoulders open and open up my palms as sitting on my lap. And I'm going to feel a nice stretch underneath my collarbone and just open up through that area. But again, it's kind of like, I do that. That feels like it resets me a little bit. But then I'm like, okay, now it's time to move a little bit more and change the way I'm at. I'm lucky. I'm in a job where I'm walking around and I'm moving all the time, right? But for anybody that's sitting at a desk all the time or on the phone all the time, it's definitely about changing those positions because dynamic posture is the biggest thing, right? Like anything static for too long is not great. But we can sit in any position we want for a period of time. That's fine, no problem, right? Even if you sit with terrible posture round and forward like this, our body can handle that. We're not fragile, right? But it's only like when we get stuck in that position for a long period of time that everything kind of falls apart.
So is that where we see kids on their phones and even adults as well, is the whole hunched over and it's in for long periods of time? And
exactly. It's the prolonged stuff with that too, right?
Yeah.
Is it going to be this crazy detrimental thing that's going to ruin their lives? Probably not. Like we'll see 20 years from now, right? But probably not because like I said, we're not fragile. But I think the thing is that we have to remember that we just need to vary the way we're doing that stuff. So if your kid's going to be on his phone or the iPad all the time, maybe just force him to sit in a little bit of a different way or something like that too. The cool thing, like, I don't know, we don't treat many kids at the clinic. That's not our kind of like go-to thing.
Yeah.
But when parents bring their kids in, they always throw a tablet to them and they're sitting on the couch there. The cool thing about kids though is that they don't really seem to sit that still if they're into something,
Yeah,
right?
it's true.
Mhm.
So I can sit there and watch a kid on the couch at the clinic playing on his tablet, and he's switching positions every 2 to 3 minutes, right?
Mhm.
Because he's getting excited about stuff, right? Where he doesn't seem to get locked in quite as much as an adult would. Now, I'm not saying that's the case for every kid, because
Right,
like I said, I don't know kids well enough to kind of comment on all that.
Yeah.
But I think as long as they're moving, they're okay, right? So, like, I don't think it's the worst thing in the world, but it's kind of like, I would rather not see that just kind of locked in position all the time, right? So,
Are you seeing people come into the clinic complaining more and having that kind of neck, because of it's the neck down, looking at the phone all the time? Is there any carryover to that?
like a couple of years ago, there's the big thing about text neck or something like that.
Yeah.
And I'm like, okay,
Once in a while, it'll pop up on social media.
yeah, it still pops up there. And it's like, it sounds scarier than what it is, right? Again, just change the way that you're doing that. People used to read books and read newspapers in the same
Right.
position.
You're right.
So it's kind of like, things
You're right.
haven't really changed that much. I have a phone here and I'm probably spending more time. But like, how many people you spend hours and hours reading a book in that same position? And
You're
like,
right.
we survived that as well, right?
Yep.
So,
Mhm. Okay. What is one red flag for people like us that is kind of a warning sign for us that we need to see a chiropractor? You probably have already answered it, but
I think the biggest thing is like, we would like to see people when they're feeling kind of achy, kind of stiff and all that. So if you're getting out of bed in the morning and things aren't kind of like loosening up as quickly as for sure. Sometimes you get out of bed, it takes a couple minutes to kind of get stuff moving. I'd say if you're getting out of bed and it's getting tougher and tougher to straighten up and all that kind of stuff and get your day going, that's when a big thing right away. It's like, hey, let's just go get something checked out, make sure everything's looking okay, and see if they can help me out a little bit with that. Other than that, everything is so pain related that we see, right? That like most people go, oh, I'm in pain, I'm going to do this. But like, there's not always pain associated with that morning stuff. Just like, why the hell am I so stiff when I'm getting out of bed, right?
Just so it's lying like, down. It's just lying down for 8 hours.
Right? So it's like, I think red flag might be a little bit of an aggressive term for something like that, but it's kind of like, hey, maybe I should do something about this because I shouldn't be this stiff in the morning when I haven't really done anything, right? So
how do I know if I should see a chiropractor or a physiotherapist?
I should
or
say
both?
chiropractor, but so I don't want to upset any physiotherapists out there, but I think we do have our own kind of like niches that we work really well in. When it comes to kind of manual hands-on therapy, I think chiropractors hands-on are going to be the best. I know a lot of physios are doing more and more manual therapy and they're getting a lot better at it, but we've just been doing it a lot longer as a profession. When you like physiotherapy, post-surgical stuff, heavy duty rehab stuff as well, I think is where you default to them. I'm not going to do kind of like very nuanced rehab type stuff with my patients. The stuff we're going to do in our gym area is going to be more kind of like retraining how to do the bigger movements, right? So it's almost like, I think we can work hand in hand with the physiotherapist where come and see us first and we'll take care of all that kind of tightness that you have. If there needs to be some of this really nuanced rehab stuff, I'll send them off to a physiotherapist.
Right.
And then if you want to get into the bigger stuff, come back and see us or go see a personal trainer as well. That we can all work a little bit synergistically together. I would imagine that, probably in the next 10 or 15 years, there's not going to be a ton of difference between chiropractors and physiotherapists because we tend to keep encroaching on each other's territory a little bit more and more as the years go on. You see a lot of chiropractors who are becoming a lot more kind of rehab focused, and you see a lot of physios who are becoming a lot more manual therapy focused. I think now we're still kind of distinctly in our own categories, but I think over the next few years, you're going to see a lot of that blend between all of that stuff for sure.
Okay.
Yeah, interesting.
Kind of going back to the people that can't, roll out of bed very well and are in pain. Is this a lack of movement, or would you say that there's also other factors like inflammation in the body, a person's diet?
For sure. Like whole body inflammation that from diet and from all that stuff is huge, right?
Yeah.
And that's another thing that we talk with our patients about all the time.
You do? Okay.
And it's tough because you see some patients coming in and they're like, why am I always in pain? And they're walking in with a bag of food, or you see them going and they're going off and grabbing a burger once they're done their treatment. I'm like, this doesn't make sense in my head, right?
Yeah.
And you try to explain to them, and especially in places and with people who enjoy a lot of alcoholic beverages, and alcohol is very inflammatory, especially when you're doing it on a large scale, right? And if it's one of these things where people are going out every weekend and drinking and partying and doing that kind of stuff, and they're like, well, why does my body feel so bad?
Right.
Your body's inflamed. And again, as we get older, it takes a lot longer for our body to buffer out all that inflammation, right?
Yeah.
So sometimes it feels like we are fighting a little bit of an uphill battle with people.
Yeah.
Because you tell them like, hey, if you want to feel better, this is the stuff you have to do. And they go, well, I like going out on the weekend. So it's like, okay, maybe just cut it back a little bit. And it's a work in progress. But inflammation in the body is a huge thing. And whether that's alcohol, whether that's diet, for sure, it's going to have big play.
Well, it can also, you can kind of see the trickle down effect where there's like a hard night of drinking and partying. But if you go to the gym the next day and work out really, really hard and extra hard, it's going to make it all go away, where it can actually increase the inflammation even more.
For sure.
Because you have just completely ripped down your body.
Yeah. And then when your recovery from the gym is going and having more happy hour drinks,
right?
It's just a cycle that you just can't break, right?
Yeah.
But it is, people seem to get in these extreme mindsets, right? So we're like, I need to do everything to the extreme. I'm going to work out to the extreme. I'm going to party to the extreme. I'm going to eat to the extreme, right?
Yeah.
If we can find a balance with all that stuff, then we're much better off, right?
Yeah.
And it's kind of like, if you're going to work out to the extreme, you need to allow your body to recover, right? And your body can't recover when it's now processing alcohol and bad foods and all that kind of stuff too.
And not getting good enough sleep.
And sleep's huge. And I don't think anybody really gets enough sleep. We have a million reasons for that. And you can go through the list of things where why people aren't sleeping enough, but like we need to do that if we're going to recover properly, for sure.
And you talk to your clients about that when they come in?
If they listen. Yeah. If they listen.
Okay.
Yeah. We try to, because I think the whole thing is like, the way we look at health and the way everybody should look at health isn't just kind of like this one linear thing, right? It encompasses all these other things as well. And we try to kind of educate enough on all those bases. And do we have all the answers now? No. And there's all these things where you read this stuff online and like, I don't know if the stuff's accurate or not, right? So, but I'm like, I think the basic stuff is still there, right? It's kind of move, eat well, probably don't drink often, and get enough sleep and work out and move and move and move and move, right? Like that's it. So
a little bit more and move. Okay. So we do see, this is kind of probably the most famous thing that a lot of people see right now when it comes to chiropractors, is a lot of those social media videos with the microphone and like listening to the cracking sounds. And like, would you say that that's an accurate reflection of chiropractic care?
I think a lot of the stuff that you see online is probably not very, very accurate of what we do in the clinic. I would say, like, if you were to actually videotape any of my sessions, which I know some people have, and there's been some stuff posted online of me treating, but it would get very, very boring because the stuff does look very similar from patient to patient. The adjustments don't change. They're not these big crazy things. I know the adjustments sound huge on those videos, but like, that's only because the microphone's where it's at. Right.
Yeah.
Until I realized that, I was like, what?
Yeah. The adjustments aren't that loud in person, right? They make a sound, but they don't make a sound that big, right? But you see some of these weird things on, like with people putting straps around people's necks or like hitting people with like a little hammer, and like we get patients that call like, hey, did you do that? I'm like, no, we don't do that. That's crazy. But it's kind of like, I think the bigger and the crazier the stuff is on social media, the more people are going to get eyes on it, and that's all they care about. Our whole thing is, can we take those patients and educate them properly what chiropractic care is actually about? Because they're showing an interest in what's happening, but actually explaining to them kind of like what we're trying to do and what a real treatment kind of looks like is the biggest thing. Like social media, like we talked about before, it's good and bad. Like I think a lot of that is bad for the profession because it makes us all look a little bit crazy. But on the other end of things, it's good because it puts eyes on a profession, it makes people ask questions. And as long as they're coming to the right people that aren't just going to kind of do whatever these videos are showing, I think we can educate patients properly and be like, hey, this is what it's supposed to look like. And this is what it's supposed to do. And this is what our goals of treatment are going to be.
Right. It doesn't necessarily mean the loudest crack is the best thing.
No, sometimes I don't even hear it, but you can feel it.
Yeah, it's for us. It's all about in Chiro school. They would reiterate the point all the time. It's kind of like, it doesn't matter if you hear anything.
Yeah,
a lot of the time it's going to make a sound, right? But for us as chiropractors, like our tools are our hands, and if we feel something moving, then I'm happy with that. We're not going to force anything just to make a sound because that doesn't really make any sense to do so, right? If we've kind of provide a therapeutic benefit and it doesn't make a sound, great, cool. You're going to feel better. Right. So,
Okay. So if a person leaves and they feel a little bit sore, or they feel a little bit sore the next day,
that's normal.
I was just going to,
especially if they haven't had treatment in a very, very long time.
because the body's now in a position where it hasn't been.
It hasn't been. And the body wants to go back to the state it was in, that it wasn't good before. But it's also like, we've beat up a bunch of soft tissues. We made stuff move that hasn't moved in a long time. Your body's like, whoa, what's happening?
Right.
And there is going to be a slight amount of inflammation after you, like, it's the same thing. If you go get it like a deep tissue massage or something like that, probably you're going to feel a little bit sore when you're done if they went deep in there. Right. So, but yeah, we again try to tell most of our patients. I think most of them don't listen when I tell them this, but it's kind of like, yeah, if this is your first treatment with me, you're probably going to feel a little bit sore this evening, maybe into tomorrow morning. But once that wears off, that's when we should notice the big changing effects of everything. But that's nothing to be scared of, because again, it's now, again, figuring out what's the difference between kind of pain and discomfort. Again, like we talked about right at the beginning, right? It's kind of like, you might be uncomfortable. Is that really pain per se? I don't know. I don't think so.
Right. Okay. Are there any trend words or buzzwords in wellness that you think women should be cautious about?
I don't know if I can think of any buzzwords off the top of my head, but it's like anything that's, I think we talked about before, anything that says this is the solution for you, right? Or this is the fix, or this is the hidden secret that nobody's telling you. And like, that's all garbage all the time, right? That's like, if it was that easy, we'd all be doing it, but we'd all be feeling amazing. Like healthcare bodies, they're complicated, right? So if like somebody's telling you this is the solution for everybody, then it's not, right? So I think those are things that we really have to be aware of, not just women, but just men and everybody in general when it comes to healthcare. People are undereducated about their bodies and undereducated about like their nutrition, like we talked about before. So they read or hear something online and they kind of take it for fact way too quickly. And I think we have to dial that back a little bit. And like, again, there are no hidden secrets out there. We're all still figuring stuff out. Some of us know a little bit more than others, but like, if there's a hidden secret out there that can fix every problem, then like, I wouldn't have a job. We'd all be feeling great. It doesn't matter, right? So
what is one thing that you wish every client knew before their first visit with you?
That it's not as scary as it looks online is pretty much the big thing, right? So I think some people again, we get a lot of first time chiropractic patients in our clinic. And I think it's because we have a very like good communication with our current patients, and they send people in, even if they're a little bit hesitant, they come in like, so-and-so sent me in here and they said, you're the best. So I'm going to trust you. Right. But a lot of them are very scared the first time they come in, just because they've watched some stuff online. They go, oh, I'm going to go to the chiropractor, I'm going to watch some videos. People do get scared mostly with the neck adjustments and everything like that. Some people are hesitant with that stuff at the beginning. And I will say that I explained to every patient that it doesn't look like what it looks like online. And we actually just filmed a video with me and Dr. Wyatt in the clinic of her adjusting my neck so that I could show some people like, this is the limited amount of movement we're actually putting into your neck. Because online, I think they make everything bigger and crazier. And there's so much rotation put in the neck where people look over the shoulder. Adjustments in real life from good chiropractors don't look like that. So it's definitely not as scary and it's not as loud and there's nothing really to be intimidated about. But there's lots of patients who come in that are like, hey, I don't want to be adjusted. And that's okay too. Like we don't adjust every single patient that comes in. But a lot of people think I'm going to a chiropractor, he's going to adjust me. That's the only option that we have. We have a lot of tools in our toolbox that we get patients in and sometimes we don't adjust them. Sometimes they don't need it. And it's all about kind of figuring out what that patient needs. So like the care is individualized, right? So it's like, if both of you are to come into my clinic back to back, you're probably not going to get the same treatment, right? Because I'm going to figure out what your body needs and what your body needs.
And I don't even get the same treatment every time I come. Like it depends on what I'm complaining about. It depends on
what you're coming in. But like, even if you come with the same complaint, sometimes we find stuff that's different.
Exactly.
Right? One day somebody might come in with their neck locked up and it needs to be adjusted. The next time it's like, oh, the joints are feeling pretty good in your neck. Let's just work on all the soft tissue around there instead and not worry about that. So day to day, and this is what I said before about us having kind of like these half-hour treatments, because if I didn't have that time to spend with patients, then it's just kind of on the table, see you later, see you next week or whatever kind of thing is, right? So, but this is where it is taking time and kind of figuring out patient by patient. And that's why anybody who's coming in the first time just has to know that like the care they're going to be getting is going to be focused on them and individualized to them. And it's not going to be as big and crazy and scary as what they've kind of probably made it out to be when they watch your videos online, right? So,
So were you getting treated when you were younger? Like for when you were playing sports?
Yeah. So my parents went to a chiropractor when I was younger. And then when stuff would happen, they would take me there. So it definitely wasn't like a regular thing, but like if I was hurt or something, I was growing up playing sports, all that stuff, they would take me to chiropractic. I don't think I saw a physiotherapist until I was kind of in college, and because we didn't have a chiropractor on our hockey team. So we just saw athletic trainers and physiotherapists while I was in college. But yeah, when I was younger, I definitely see them. And again, it was more of like the old school type kind of chiropractic stuff where it was quicker treatments. But it wasn't until I got into sort of my teenage years or in the summers in between kind of like college where I started seeing some of these chiropractors that were doing really, really cool things and doing more than just adjustments. And I think that's what really sparked my interest in the profession. Because if it was like it was when I was a kid, I probably would not be doing this because it didn't interest me and it didn't really seem like it was a full rounded treatment. But I think, yeah, growing up in the sports world and seeing a chiropractor when I was home in the summers before I went off to college, it was a big thing that sparked my interest in that stuff. So,
oh, cool. Okay. If you could give one piece of advice to women in midlife, so we're just talking about women right now.
Just women.
About their health and wellness, what would it be? Like from your standpoint, from what it is that you do as a job?
I think the big thing is, again, like we'll go back to moving and strength training is the biggest thing that I will tell women of any age, and especially in midlife, that like we need to add strength training on top of everything else we're doing. Yeah. So movement is the number one, but like strength training is right there with it. Where if we're skipping that, then we're missing a big piece to women in their midlife. And take some of your health into your own hands. Ask questions and all that kind of stuff. When you go see your practitioners or your doctors or whoever you're seeing, ask them questions, because I feel like a lot of people are scared to ask their practitioners or doctors questions that they don't know because they don't want to seem like they're asking a stupid question or something like that, right? Ask us. The amount of like questions that we get every day that some people would think are just dumb questions, but like there's not a dumb question. If you are uncomfortable with something, ask about it, right? So I think that's a huge thing that's also missing is kind of like we have to take healthcare in our own hands because nobody understands what else is happening with their body other than what we're experiencing, right? And if all we do is go to the doctor, let them run tests and tell us what's wrong with us, but we're not pushing for anything for ourselves and not being an advocate for our own health, then it doesn't really make sense either.
Right. Actually, I think I heard that they're getting a bone density scanner. Do they have one on the island?
I think there is one on the island now, but it's not easy. Yeah, it's not easily accessible right now. But I think Health City is putting one in as well. Okay. And that's a big thing too. Is kind of like keeping up to date on that stuff as well. Right. It's like, again, if you get one done and your bone density is decreased, it should be something you should keep your eye on quite regularly, right? So, but 100%. As women, again, like I said, over the age of 30, everything starts going downhill as far as bone density goes. That's something for sure, just to keep your eye on, especially if you haven't been doing much strength training in your life, right? It's just, it's one of the factors of aging. But again, nothing to be scared of if you keep your eye on it, but just don't let it kind of just pass you by. Because like I said, with bone mineral density, once it's gone, it's gone. Let's try and hang on to that as much as we can.
So if you were to get a woman to come in and she's in her 50s, any 40s, 50s, or 60s, and she really hasn't done a whole lot of weightlifting, where would you start with someone like that? Like, what would be the advice that you would give them?
Well, it's about either, like, again, I love personal trainers. And if you can find a personal trainer that you are comfortable with working with, I think that is a great option for a lot of people. And it's not something you have to do forever. You don't have to keep going to that same personal trainer, but just to get the basics right is important. We will work with some of our patients and show them some things, but we don't have the time or the capacity to kind of spend an hour and a half with some of these patients to teach them all the things they need to know. So I think that's where having like a network of personal trainers, and there are some great personal trainers on this island here too, that I think that's a great starting point for people. And I know personal trainers and all this stuff can be a little bit expensive as well. But again, it's just, let's put some money towards our own healthcare and our own well-being. I don't love the idea of, if you haven't done anything, just jumping into some group fitness class right off the bat. Cause I feel like we've seen a lot of that in our clinic, and we see a lot of that all the time, where it's like, you start and it's like, well, like you didn't learn how to squat properly first. Right. And you'd be amazed that like squatting seems like it should be such like an easy function, but how many people just don't do it correctly? And then you do that incorrectly in a group fitness class over and over and over again. and then you're back in my office again with a lot worse pain than you had probably to begin with, right? So
Yep.
I'd say finding a trainer or some sort of movement expert that you trust, and even if that is going to see a physiotherapist and be like, hey, I don't really have a whole lot of pains and stuff like that right now, but can we just kind of go over some movement pattern stuff with me?
Yeah.
You can see us and like we can do some movement patterning stuff with you too.
Right.
But like I said, like I think personal trainers where they have access to a little bit of the heavier weights and stuff like that too, so they can kind of find your limits to start you off with, right? I think a lot of people are just too scared to pick up the heavy weights at the beginning and women
to start.
Yeah. And it's kind of like women at the beginning, like you can watch a lot of women who are very unconfident in the amount that they can lift, and you watch them like, you are so much stronger than you actually think you are, right? It's kind of like those 5-pound dumbbells are not doing anything for you, but they're too scared to pick up anything bigger, right? Because nobody's told them or showed them what it's supposed to feel like, right? So I think it's finding a professional that you trust, whether that be a chiropractor, physio, personal trainer, that can just kind of ease you into it a little bit, right? Or even just a friend that you know that goes to the gym. Be like, hey, I want to start. And I think the biggest thing is taking that first step. And like gym culture used to be scary too, right? But the gym, it tends to be a very welcoming place if you go in there and don't have a problem kind of like asking for a little bit of help. Nobody's ever judging, right? And especially if you go in there with a friend that knows a little bit more, then just go to it.
Right. Well, I know my mom's in her 60s and she started going to the gym. I don't know how many times she goes to the gym a week, but I would probably say 4 or 5.
That's awesome.
Yeah?
Yeah. And she only started a couple of years ago.
Yeah.
Yeah. She's in her 60s,
But
which I think is awesome.
That's amazing.
And so like even with like in your 60s with decreased bone mineral density, like we're talking about, the more muscle you can put on around that stuff too, the more protected you are.
Exactly.
Right. So it's kind of like that's awesome. It's never too late to kind of start that stuff either, right? Yeah. It's kind of like, again, if you kind of just keep putting it off, then 5-10 years from now, you're just in a worse place than you were, right? So,
but it's not too late. Like say if there is somebody in their 50s who has not done a lot, start now.
Go do something.
Yeah.
Yeah. Go lift some weights, go move, right? Like that's huge. And don't be scared of it either, right? Because it's not a scary thing, right? It shouldn't be. It shouldn't be.
Okay. Hot flash, hot take.
Okay.
So we do this something on the podcast.
We do a rapid fire.
Okay.
It's like a rapid fire. Hot flash is bad. We don't want it.
Okay.
Hot take is good.
Is there any? Can I explain any of the reasoning behind it?
Yes, please do.
Okay. So it's not just like a.
Yeah.
Okay.
It's not like a yes or no.
Because there's a lot of nuances with this stuff too. I think, right?
For sure.
So.
Yeah. Okay. So the very first one, hot flash or hot take, spinal decompression therapy. Is that the one where you hang upside down?
It can come in a couple different versions. There's some big machines out there that can hook you up to as well.
Okay.
I think for the most part it would be a hot take. That's a good one.
Yep.
But again, it's patient dependent because there are some patients who do really well with that stuff, right?
Okay.
So there are inversion tables where you flip upside down. All that's going to do is elongate the spine, open up some of those disc spaces, which feels great. But then there are some people that it feels pretty bad when they do that too, right? So it's all about kind of like, again, same thing what we do in the clinic, selection criteria with the patients to see what's good or not. But for the most part, I think the majority of people feel pretty good with that. But if you're going on an inversion table, don't do it by yourself. Right? 'Cause you might get stuck upside down. We've seen that. We've seen that too, right? So I wish I have this video of Dr. Norman kind of doing it by himself in his house, and it might be one of the funniest videos I've ever watched.
I was just going to say, having one in your house is like not the smartest. I've seen a lot in people's homes.
Yeah.
Have you?
Yeah, it was just I think it was a fad at one point. I don't really know why. People wanted to do it.
Because you feel good when you're upside down because it opens everything. If you have chronic low back pain, that kind of stuff, it does feel pretty good when you're on there, right? So, and I think there are settings so you don't go completely upside down and get stuck. So you can get yourself off. But the first couple of times you use it, if you're using it at home, just don't do it solo, just in case you get stuck
make sure somebody else is home.
Posture correction gadgets.
I'm going to say hot flash for that for the most part. There are some things I've seen out there that are little like buzzers that you can put on your back that kind of buzz. I think those in general might be okay. I haven't tried them out to see how well they actually work, but I get asked all the time about what these straps to put around your shoulders, pull you back. And as we talked about before, where posture should be a little bit more of a dynamic thing. I think those things are awful because again, they're locking you into a certain position and you're not really training the muscles around that area. And so everything just kind of, it's like putting a brace on it, right? And it's kind of like, if you put a cast on your arm and don't move it, what happens to the muscles underneath? They deteriorate, right? So,
okay. Foam rolling and massage guns.
Again, probably a hot take. I like them as part of like a bigger kind of protocol of everything else. That goes along with anything else with recovery tools and all that kind of stuff. They can be beneficial, but they're not going to fix the problems, right? I think they're great to use as a maintenance tool. Massage guns are great for that. Foam rollers are great for that, increasing some blood flow to the area. If you have an injury or you're actually in pain, they're not going to help with that. So I see a lot of people that will take a massage gun and really drill into areas that they're actually sore, maybe injured, and probably can make some of that stuff a little bit worse. So I think it's, again, about finding the right kind of protocol for that. And yeah, if you're using almost on like a daily basis, like a warm up or like a post workout type thing, I think they're great.
Okay. Chiropractic adjustments for non-pain issues. So digestion, sleep, immunity. I have some questions around this one.
I think that's a hot flash. I don't know if I can.
No?
No.
Okay.
I think when you look at what we do as a profession now, especially at Modus, we're pain people, we're movement people. I think there are some crazy stories that you hear where chiropractors have fixed certain of these issues, but they're not very like repeatable, right? So they're hard to study. They're hard to show that they actually do anything, right? So when it comes to like immunity and stuff like that, there's some stories about chiropractors like fixing people's asthma and stuff like that, but there's no real logical reason why that's happening, right? But I've seen some weird stuff as a chiropractor where you treat somebody for their pain or the dysfunction that they're having, and some other stuff changes. Like, okay, well, that's cool, but I'm never going to go around and say this is something I can actively treat. Yeah.
I do also think that it goes hand in hand with a number of other things. So if a person is taking the initiative to go and see a chiropractor and start to get healthy and start to get better, they're probably starting to change other things in their life as well.
For sure.
So kind of like what you said is like, which one was it?
For sure. Yeah. And at the end of the day, like, I think as long as us as practitioners are being honest with the patients and saying, I have no idea if there's actually help with that and we're not doing any harm to them and they want to try it, I guess fine. But I would be very hesitant to go and advertise or say that I'm going to fix any of this stuff, or I would be very hesitant to go or even recommend another chiropractor who bases his practice on stuff like that. Because like I said, where the research is for us as chiropractors, we can help dysfunction, we can help pain. That's the biggest stuff that we do. There's lots of research to support us helping people get out of pain very quickly, very effectively. There's not a whole lot of research on some of that other stuff as well.
This is why I'm kind of excited about this one, but I have seen people like that I have spoken to, clients who have been to a chiropractor that actually helped sort out their digestion. And I don't know if it was maybe some stuff that was going on with like the low back or like just things that were squeezing or twisting or blocking.
Again, possibly.
Yeah.
Right? Is the best answer I can probably give for that. And there's, again, old school kind of vitalistic chiropractic stuff where they would say that if we adjust these certain spots, it's going to help fix this. I think if we are looking at something like digestion, it's probably more of just a tension issue through some tissues, not actually a specific spinal segment causing digestive problems, right? Okay. So it's again, it's the way it's being communicated to the patients, right? It's if I'm saying I'm going to adjust your L4 vertebrae and that's going to help you with your digestion, I don't know if that's actually accurate.
Right.
If I adjust you and do some soft tissue and stuff starts to work and move better, and it takes some of the tension that's surrounding that area and things get better, great. See,
and that's what has happened. Yeah. So it wasn't really something where they went in and the person's like, I'm going to adjust this and this is what's going to happen.
Exactly.
But the benefit from it, part of like the indirect benefit
for sure
from it was
for sure. And that's why I said, like I said, there's some crazy cool things that over the years as a chiropractor I've seen, but I'm just hesitant to ever say that this is something we can do. Okay. Right. Yeah. So I think there's a difference there between we can do it and sometimes it happens.
Yeah.
Right?
Okay. Cracking your own back. Ooh, and cracking your neck because my child does this. Yes.
I don't think it's as bad as some chiropractors make it out to be. It's if it was that dangerous, then we'd be in a lot of trouble as a profession as well. But it's the same thing if you hop on a foam roller and you kind of lean back around it and your mid-back pops and cracks. Normally what I tell my patients is like, if you move and you're stretching and stuff pops, or if you're laying side lying and your low back pops, or if you turn your head and you hear a couple cracks and pops, not a huge deal. I would say if you're sitting there and like really reefing on your neck, trying to pull on stuff to make stuff pop, probably don't do that. Is it going to cause some crazy harm to you? Probably not, but like you can probably cause a bit of pain after some of that stuff because the muscles aren't in a relaxed state to allow that to happen. when we're adjusting people's necks, a lot of times they're laying on their back, everything's kind of fully relaxed, and we're waiting for them to relax before we adjust their neck. If you're sitting up and you're kind of pulling on your neck, like, yeah, your muscles aren't relaxed, and it's probably not the best. But like, if you're stretching and you're moving and stuff's popping and cracking, don't worry about it. Nothing bad is happening with that. So
Okay. And last one, cupping, and how do you say that?
Gua sha?
Guasha.
Gua sha.
For
And
pain
Cupping.
relief. And cupping.
for pain relief, I think, again,
Do you do cupping?
we do a little bit of it for sure. Again, on a case-by-case basis, it's probably on my list of things that I do with the patient, it's probably closer to the bottom
Okay.
because I get a lot better results with the stuff at the top.
Okay.
But I don't see any real problem with it. And again, the way that those modalities are going to be done by a traditional Chinese acupuncturist or something like that, or Chinese medicine practitioner, are going to be slightly different in the way that we do them as well. So the way that we would use something like that would be a lot of just to loosen up some fibrous tissue or promote blood flow in the area. And that's all the cupping is really going to do. It's going to bring some blood to the surface of the skin. Again, I don't know how good the research is on it, but like we've seen some really cool results with that. I normally save cupping and that kind of stuff for if patients don't seem like they're responding to the regular stuff that we do. And then we'll kind of, we'll try this out. And yeah, sometimes just a little bit of like decompression of the tissues on top of each other seem to help a little bit.
Okay.
Yeah.
That is all for my questions.
Yeah, that's all we got.
That's it.
How can people find you if they want to come see you?
On Instagram, moduskman.com or moduskman.com on Instagram, just moduskman. You can call us. Our phone number's on the website. I don't know what it is. But you can phone, WhatsApp. We have an online booking software as well in case anybody wants to do that. But even if you just have any questions and just want to reach out, like one of the three of us is probably available to chat and kind of answer some questions for anybody. So
that's awesome.
Yeah.
Well, thanks.
Yeah,
we
that's
appreciate
great.
it. Yeah. A lot of stuff I did not know.
Well, that's what you're inviting people on for, though, right?
Exactly. So
Yeah.
get that education out there. Thank you so much, Derek.
Thank you.
Yeah, we appreciate
great.
it.
Awesome. Thank you.
Thanks.
Thanks for joining us on Breast Intentions. We hope you felt seen, supported, and maybe had a few laughs along the way. Don't forget to share, subscribe, rate, and review us. Your support keeps the conversation alive. Follow us on social media for more insights, behind-the-scenes fun, and updates on future episodes. Got a topic you want us to dive into? We'd love to hear from you. Remember, life's too short for bad bras, toxic relationships, and kale you don't actually like. So until next time, stay bold and keep your breast intentions exactly where they belong, front and center. Now go crush midlife, or at least today's to-do list. Cheers!